we haven't made adequate investments for hygiene, and hand hygiene being a critical component. We haven't made enough investments if we're looking at the household level. We have made some investments when we look at schools. I think under Swachh Bharat mission, we've seen a lot of attention that has gone not just to toilets in schools, but also to make sure that hygiene infrastructure as well as water facilities exist there. But when we're looking at community settings and other settings, worksite settings, public spaces, there's a lot that we need to do to make those investments for the hardware as well as two aspects of software. I'd like to split that into, one is the awareness component, which I think that is essential. And then we look at digging deeper into how do we inculcate this into a sustained habit or a practice that people will continue. We need to start making this shift in our minds that using fear as a motivator can be done for only limited periods of time, and that we really have to shift gears if we're looking at making people realize the personal importance of these behaviors and make hand hygiene and other hygiene behaviors a social norm, as those of us working in behaviors will say. I think we've also learned that it's important to push hand hygiene, but hand hygiene cannot be pushed in isolation. What we're learning is it needs to be a part of a suite of behaviors or a group of protective behavior. So, for example, if we go back to sanitation, we need to link hand hygiene with use of toilets. If we're talking through health programs to mothers, adolescents, and others, then we need to be able to link hand hygiene with other health aspects. So it needs to be a part of a larger suite. So we need to be looking at it as holistic. It's a part and a very critical part of a bunch of behaviors that we need to be promoting. Making this link also helps individuals and communities adopt the behavior. There's also, I think, some things that we need to do in terms of changing our messaging on hand hygiene.